Welcome back, everyone, to another deep dive. And today we're going deep into the world of Cushing syndrome,
Ooh.
a condition that I think a lot of our listeners are already familiar with, but maybe you want to understand on a deeper level.
Right?
And we've got a stack of medical research right here ready to uncover some of the surprising intricacies of this hormonal disorder.
Absolutely.
It's more than just those striking symptoms,
Right.
that you might think of like the buffalo hump
Yeah, the classic.
and those kind of purplish stretch marks that can happen.
Yeah.
We're going to explore why Cushing's is often missed,
Okay.
the unexpected ways it impacts the body, and even delve into some of the diagnostic challenges that doctors face.
Wonderful. I'm excited.
Yeah, this will be good.
Okay.
So, to kind of kick us off,
Sure.
why don't you give us a little bit of a background on Cushing's syndrome?
Yeah, it's really fascinating how a condition that's caused by an excess of something that our bodies naturally produce
Right.
can have such widespread effects, right?
Yeah.
So in Cushing's, it's not just that you have high cortisol, it's that your body is exposed to these high levels for prolonged periods.
Right.
And that's where the real trouble starts.
That prolonged exposure really seems to be the key here.
Yeah.
So let's talk about where this excess cortisol is coming from.
Yeah, okay.
I mean, it's not as simple as just your body is overproducing it, right?
No, you're absolutely right. It's a bit of a detective story, actually.
Okay.
One of the most common causes, and this might surprise you,
Okay.
is the use of glucocorticoid medications.
Really?
Yeah, over 10 million Americans are prescribed these each year for conditions like asthma, arthritis, and inflammatory bowel disease.
Wow.
So while these medications are incredibly effective, long-term use can lead to Cushing's syndrome.
So it's like kind of a double-edged sword?
It is? Yeah.
It helps, but then it can also cause problems.
Exactly.
Yeah, that's a significant number of people
Yeah.
potentially at risk.
Yeah.
It makes you think about the balance between treating one condition and then potentially triggering another one.
Right.
So besides medications, what other factors contribute to this cortisol overload?
Yeah, so sometimes the culprit lies outside the adrenal glands themselves.
Okay.
For instance, certain tumors, often in the lungs, can start secreting ACTH,
Mm-hmm.
the hormone that signals your adrenal glands to produce cortisol.
Right.
This is what we call ectopic ACTH syndrome.
Okay.
And it highlights how seemingly unrelated conditions can sometimes be connected in surprising ways.
It's like a chain reaction
Yeah.
happening in the body
Right.
where one problem kind of sets off another one.
Exactly.
So we've got medications, we've got these ectopic tumors.
Right.
What are some other sources of excess cortisol?
Yeah, so in some cases, the issue originates in the pituitary gland,
Mm-hmm.
which is located in the brain.
Okay.
This tiny gland is responsible for orchestrating a lot of hormonal activity in the body, including the production of ACTH.
Okay.
But in Cushing's disease, the pituitary gland goes into overdrive,
Oh.
pumping out excessive ACTH,
Okay.
which in turn leads to those chronically high cortisol levels.
So it's like the control center is sending out faulty signals,
Exactly.
and it just leads to a cascade of problems downstream.
Precisely. And then, of course, you have adrenal tumors themselves.
Right.
These can be either benign or malignant,
Mm-hmm.
and they can essentially hijack the system, producing cortisol on their own without needing any prompting from ACTH.
It's amazing how many different pathways can lead to the same outcome.
Yeah.
This persistent excess of cortisol.
It's really interesting, isn't it?
Yeah, I imagine this complexity is one of the reasons why diagnosing Cushing's syndrome can be so challenging.
Absolutely. With so many potential culprits
Yeah.
and a wide range of symptoms, it's
Mhm.
not always a straightforward diagnosis.
Speaking of symptoms, let's delve into those a little bit.
Okay.
So we know about the classic moon face and buffalo hump,
Yeah.
but what are some of the less obvious ways that Cushing's can manifest in the body?
Yeah. Well, one of the first things people might notice is a change in their body composition.
Okay.
We're not just talking about general weight gain here. It's a specific type of central obesity that affects the face, neck, trunk, and abdomen.
Wow.
Even with diet and exercise, this central fat buildup can persist
Oh, really?
because it's driven by the hormonal imbalance rather than lifestyle choices.
That must be so frustrating,
It is.
for people who are really trying to manage their weight, but it's like it's out of their control in a way.
Exactly. It's not just about willpower at that point.
Right, and it highlights how Cushing's goes beyond just the superficial,
Right.
it's impacting your body on a fundamental level.
Absolutely. And those changes extend to the skin as well.
Okay.
Cortisol has this catabolic effect, meaning it breaks down tissues.
Okay.
And one of the first places you see this is in the skin.
Interesting.
It becomes thinner bruises more easily. And you might even notice those wide purplish stretch marks called striae.
Yeah, those are very distinctive.
They are, and they're often found on the abdomen, breasts,
Mm-hmm.
and even in areas you wouldn't typically associate with stretch marks.
Huh.
The purplish color is actually due to the thin skin revealing the blood vessels beneath the surface.
So these skin changes are more than just cosmetic concerns.
Right.
They're really outward signs of this internal havoc that cortisol is wreaking on the body.
Yeah, it's a good point.
And speaking of internal changes, I understand Cushing's can also have some significant hormonal effects, particularly in women.
That's right. Yeah, women with Cushing's often experience symptoms that are related to an excess of androgens,
Okay.
which are hormones that play a role in male characteristics.
Right.
This happens because a woman's adrenal glands are the primary source of these hormones.
Okay.
And when they're overproducing cortisol, they can also pump out more androgens than usual.
So we're talking about things like increased body hair acne and even changes in libido.
Exactly.
Oh, yeah.
These symptoms can be incredibly distressing for women, impacting their self-esteem and overall quality of life.
Yeah, of course.
Interestingly, the severity of these androgen-related symptoms can sometimes provide clues about the underlying cause of Cushing's.
That's really interesting.
Yeah.
So tell me more about that. How do these symptoms differ depending on the cause?
Well, in cases of adrenal carcinomas,
Okay.
the malignant type of adrenal tumor, these androgen excess symptoms tend to be much more pronounced.
Okay.
They're usually milder in situations where the excess cortisol is driven by ACTH, whether it's coming from the pituitary gland or an ectopic source.
Okay.
And in women with adrenal adenomas, the
Mhm.
benign tumors,
Right.
these symptoms are often absent altogether.
It's like the body's sending out different signals depending on the root of the problem.
Yeah, it's fascinating.
This must be really valuable information for doctors trying to pinpoint the cause
Absolutely.
of Cushing's in a patient.
It's one of the many pieces of the puzzle
Yeah.
that clinicians have to consider when making a diagnosis.
Right.
But the impact of Cushing's extends far beyond outward appearances and hormonal shifts.
Right.
It can affect your muscles, your bones, even your mental and emotional well-being.
I was just going to ask about that. I know muscle weakness is a common symptom. Can you explain what's happening there?
Sure. One of the hallmark symptoms of Cushing's is proximal muscle weakness.
Okay.
This means the muscles closest to your body's core are the ones most affected.
Hmm?
Think about the muscles you use to rise from a squat, climb stairs, or even just get out of a chair.
Right.
Those are the ones that become weakened in Cushing's.
And this is all tied back to that catabolic effect of cortisol we were talking about earlier.
Exactly. Cortisol is essentially breaking down muscle tissue for fuel,
Oh, wow.
leading to this very specific type of weakness.
It's like your body is consuming itself from the inside out.
That's a good way to put it.
Right?
And unfortunately, the damage doesn't stop there.
Oh, no.
Cortisol also has a devastating impact on bone health.
Okay.
Osteoporosis, a condition that weakens the bones,
Right.
is incredibly common in people with Cushing's, even in young individuals.
Wow.
This is because cortisol disrupts the delicate balance of bone formation and breakdown in several ways.
Okay.
It interferes with calcium absorption in the intestines, reduces the activity of bone-building cells,
Okay.
increases the activity of bone-resorbing cells,
Got it.
and even hinders calcium reabsorption in the kidneys.
So it's almost like cortisol is launching a multi-pronged attack on your skeletal system.
That's not far off. And the consequences of this bone loss can be quite serious,
Yeah.
increasing the risk of fractures,
Right.
especially those compression fractures in the spine.
Mm-hmm.
In severe cases, it can even lead to osteonecrosis,
What's that?
which is essentially bone death.
Oh, wow.
Yeah.
This is really painting a stark picture of how pervasive the effects of Cushing's are on the body.
It truly is a systemic disorder impacting almost every organ system.
Right.
We've talked about the muscles, the bones, the skin, the hormonal balance.
Right.
But it doesn't stop there.
No.
Cushing's also has a profound impact on metabolic health,
Okay.
increasing the risk of glucose intolerance and even diabetes.
I imagine that has to do with the way cortisol affects blood sugar regulation.
You're right. Cortisol plays a role in regulating blood sugar by stimulating glucose production in the liver.
Okay.
But in Cushing's, this process goes into overdrive.
Mm-hmm.
On top of that, cortisol also makes the body less sensitive to insulin,
Right.
the hormone that helps cells absorb glucose from the bloodstream.
Okay.
This combination of increased glucose production and insulin resistance can lead to chronically elevated blood sugar levels.
So it's like a double whammy on your blood sugar control.
Exactly. Now, while full-blown diabetes is less common than just glucose intolerance and Cushing's, it's still a significant concern.
Okay.
And it highlights the importance of monitoring blood sugar levels carefully in individuals with this condition.
Yeah, absolutely. It seems like with Cushing's, there's this constant interplay between different systems in the body,
Right.
all being thrown off balance by this excess cortisol.
That's a great way to put it.
Yeah.
And this interplay becomes even more critical when we consider the cardiovascular risks associated with Cushing's.
Yeah.
High cortisol levels can directly damage the heart, making it work harder.
Right.
And they can also make blood vessels more sensitive to substances that constrict them,
Okay.
leading to hypertension or high blood pressure.
And we know that untreated high blood pressure is a major risk factor for heart attack and stroke.
Exactly. And here's where the different causes of Cushing's come into play again.
Okay.
In cases of ectopic ACTH syndrome, the hypertension tends to be more severe.
Really?
This is because, in addition to its glucocorticoid effects, cortisol also starts acting like a mineralocorticoid,
Right.
mimicking the effects of aldosterone,
Right.
a hormone that regulates salt and water balance.
Okay.
This aldosterone-like effect further contributes to the elevation in blood pressure.
So depending on where that excess cortisol is coming from,
Yeah.
the impact on the cardiovascular system can vary.
It's another layer of complexity in this already intricate condition.
Yeah, and just when you thought we'd covered all the potential complications, there's one more risk factor that's often overlooked.
Oh.
I'm almost afraid to ask. What is it?
Blood clots. Studies have shown a significantly increased risk of venous thromboembolism, or VTE, in people with Cushing's syndrome.
That's concerning. What's the connection there? Why would excess cortisol increase the risk of blood clots?
It's not entirely clear, but it seems to be a combination of factors.
Okay.
Cortisol appears to increase the production of clotting factors in the blood, those proteins that help form clots,
Right.
while also decreasing the activity of substances that break down clots.
Okay.
There's even some evidence that it might elevate levels of homocysteine,
Right.
an amino acid that's been linked to an increased risk of clotting.
So it's another example of how Cushing's can tip the scales in the body,
Absolutely.
disrupting these finely tuned systems that keep us healthy.
You're absolutely right. And we've only scratched the surface of the physical effects of Cushing's.
So really?
What's often overlooked, but equally important,
Okay.
is the profound impact this condition can have on mental and emotional well-being.
I was just about to ask about that. I remember you mentioned earlier that Cushing's can cause personality changes and psychiatric symptoms. Can you elaborate on that a little bit?
Absolutely. It's crucial to understand that the mental and emotional effects of Cushing's are not all in your head.
Right.
They are very real and directly related to the hormonal imbalances caused by the condition.
So what are some of the most common psychological symptoms that people experience?
Well, one of the most frequent is emotional lability,
Okay.
meaning people experience rapid and often extreme shifts in mood.
Okay.
This can manifest as irritability, anxiety, tearfulness, or even bouts of anger or aggression.
Wow.
Yeah.
And I understand that depression is also common in Cushing's.
It is, and this is a particularly important point for the listener to understand.
Okay.
The type of depression associated with Cushing's is often atypical.
What do you mean by atypical depression?
Well, with typical depression, we often see symptoms like loss of appetite, weight loss, and insomnia.
Right.
But in atypical depression, which is more common in Cushing's,
Okay.
people might experience the opposite.
Really?
They might have increased appetite, weight gain, and excessive sleepiness.
So it can actually mimic some of the physical symptoms of Cushing's itself,
Exactly.
making it even harder to diagnose.
It can create this vicious cycle
Right.
where the hormonal imbalances are driving both the physical and psychological symptoms,
Yeah.
and it can be incredibly challenging to tease apart what's what.
It really underscores the importance of having a doctor who is knowledgeable about Cushing's
Absolutely.
and can recognize these nuances.
Yeah, a good point.
Are there any other psychiatric symptoms we should be aware of?
Anxiety is another big one,
Okay.
and it can manifest in a variety of ways, from generalized anxiety to panic attacks.
Good.
Some people even experience symptoms of paranoia or psychosis,
Wow.
especially when cortisol levels are very high.
That's a lot to deal with.
It is.
On top of all the physical symptoms,
Right.
it must be incredibly overwhelming for people experiencing this.
It absolutely is. And what's even more concerning is that these psychiatric symptoms can sometimes persist even after the Cushing's itself has been treated.
So even when cortisol levels are back to normal, The mental and emotional scars can linger.
Unfortunately, yes. And this really highlights the importance of a holistic approach to managing Cushing's.
Right.
It's not just about addressing the physical symptoms.
Mm.
It's about providing support for the psychological and emotional impact as well.
It's about treating the whole person, not just the disease.
Precisely. And on that note, there's one more aspect of Cushing's that we haven't discussed yet.
Okay.
And it's something that can be particularly difficult for people to grasp:
Okay.
the impact on cognitive function.
Oh, right. I remember you mentioned earlier that Cushing's can affect thinking and memory.
Yeah.
Can you tell us more about that?
Sure, high levels of cortisol can have a detrimental effect on the brain,
Okay.
specifically on the hippocampus,
Mm-hmm.
which is a region crucial for learning and memory.
So it's like Cushing's is directly interfering with the brain's ability to process and store information.
Exactly. People with Cushing's often report difficulties with concentration,
Right.
short-term memory lapses,
Yeah.
and even a general brain fog that makes it hard to think clearly.
Oh, wow.
Mm.
Are these cognitive problems reversible? Do they improve once the Cushing's is treated?
In many cases, yes, the brain does show remarkable resilience.
That's good.
And cognitive function can improve significantly once cortisol levels are back to normal.
Okay.
But unfortunately, some individuals experience lasting cognitive impairment even after successful treatment of the Cushing's.
That must be incredibly frustrating.
It is.
For people who are already dealing with so much, it really underscores the importance of early diagnosis and treatment
Absolutely.
to minimize the potential for long-term damage.
The sooner Cushing's is identified and addressed, the better the chances of preventing or mitigating these long-term complications we've talked about.
Right.
The muscle weakness, the bone loss, the cardiovascular risks, the mental and emotional health issues.
It's about preserving quality of life
Yeah.
and preventing those long-term consequences that can be so debilitating.
Exactly.
But as we've alluded to throughout this deep dive,
Right.
diagnosing Cushing's is not always straightforward.
It's true.
Right, we've talked about all these different causes
Yeah.
and this wide spectrum of symptoms, many of which can mimic other conditions.
Right.
So how do doctors even begin to unravel this mystery and determine if someone actually has Cushing syndrome?
Yeah, it really does sound like a medical detective story.
Yeah.
Piecing together all these clues
Yes.
to arrive at a diagnosis.
So walk us through it. Where do doctors even begin with a condition as complex as this?
Well, the first step is a thorough medical history.
Okay.
The doctor will want to know about any medications you're taking, particularly long-term glucocorticoid use,
Right.
as that's a major red flag.
Okay.
They'll also inquire about your symptoms, when they started, how
Yeah.
they've progressed, and if anything seems to trigger them or make them worse.
It's all about gathering those initial pieces of the puzzle,
Yeah,
establishing those potential connections
exactly.
between medication, symptoms, and just the timeline of it all.
Precisely. Then comes the physical exam,
Okay.
where the doctor will be looking for the telltale signs we've discussed.
Right.
They'll assess your weight distribution, looking for that central obesity pattern.
Mm-hmm.
They'll examine your skin for thinning, bruising, and those characteristic purple striae.
Right.
They'll also test your muscle strength, particularly in those proximal muscle groups that are often affected in Cushing's.
So the physical exam helps to kind of further refine the picture,
Right.
adding more detail to the story.
Exactly.
And I'm guessing blood tests come into play at some point.
Absolutely. Blood tests are essential for measuring cortisol levels,
Right.
which are obviously key in diagnosing Cushing's.
Right.
But there's a catch.
Okay.
Cortisol levels naturally fluctuate throughout the day,
Okay.
with a peak in the morning
Right.
and a gradual decline throughout the day and evening. So a single blood test might not provide enough information.
That makes sense.
Right.
So how do doctors get a more accurate picture of what's happening with cortisol levels over time?
There are a few different approaches. One option is to measure cortisol levels at multiple points throughout the day to see how they're fluctuating.
Okay.
Another strategy is to collect urine over a 24-hour period to get an average cortisol output.
Okay.
This gives us a better sense of whether cortisol production is truly elevated overall.
So instead of a snapshot, you're getting more of a continuous film of cortisol activity.
Exactly. And there are even more specialized tests that involve administering dexamethasone,
Okay.
a type of synthetic steroid, to see how the body responds. In a healthy individual, dexamethasone should suppress cortisol production.
Right.
But in someone with Cushing's, that suppression might not happen,
Okay.
or it might be blunted,
Okay.
indicating that there's an underlying issue with cortisol regulation.
So it's like you're challenging the body's system
Right.
to see how it reacts.
That's a good way to think about it. And then, of course, there's the role of imaging studies.
Right.
Tools like MRI and CT scans allow us to visualize the pituitary and adrenal glands, looking for any tumors or abnormalities that could be driving that excess cortisol production.
Right. Because if a tumor is the culprit, surgical removal might be an option
Exactly.
to stop that excessive cortisol at the source.
Right.
It sounds like diagnosing Cushing's is a multifaceted process,
It is.
requiring a combination of clinical expertise, laboratory tests, and imaging technology.
It truly is. And even with all these tools at our disposal, it can still be a challenging diagnosis to make.
Right?
That's why it's so important for individuals to advocate for themselves
Right.
and seek medical attention if they're experiencing those persistent symptoms we've been discussing.
Early diagnosis is key in any condition, but it seems particularly crucial in Cushing's given the potential for long-term damage
It is.
to multiple organ systems.
Absolutely. The sooner we can identify and address the underlying cause of Cushing's, the better the chances of preventing or mitigating those serious complications we've talked about.
Right.
The muscle weakness, the bone loss, the cardiovascular, risks the mental and emotional health issues.
It's about preserving quality of life
Exactly.
and preventing those long-term consequences that can be so debilitating.
I couldn't agree more.
Well, this has been an incredibly enlightening deep dive.
It has.
We've gone from those seemingly superficial symptoms like the moon face and buffalo hump to understanding the profound and pervasive impact Cushing's can have on the body,
Yeah,
from the cellular level to the complexities of the brain.
absolutely.
We've explored the various causes, the diagnostic challenges, and the importance of early intervention.
Yes.
It's a reminder that sometimes the most visible symptoms are just the tip of the iceberg,
Right.
and that true understanding requires us to delve deeper to explore those intricate connections within the human body.
You know, I couldn't agree more. It's about recognizing that the body is this incredibly interconnected system
Right.
and that disruptions in one area can have far-reaching effects throughout the whole.
Exactly.
And for the listener armed with this knowledge, I hope this deep dive empowers you to advocate for your own health and to seek out the care and support you need to navigate the complexities of Cushing's syndrome.
I hope so too. Thank you so much for joining us on this deep dive into the intricate world of Cushing syndrome.
My pleasure.
And a special thank you to you for sharing your expertise and insights.
Happy to be here.
We hope this has been an informative and empowering journey for our listener. Until next time, keep exploring, keep learning, and keep diving deep into the fascinating world of knowledge.